A lot of you have holiday travel plans coming up, and there are some steps you can take to stay healthy during your trip. And joining me now is Dr. Neha Marula, a primary care physician at Stanford Healthcare. Thanks so much for coming in this morning.
Thank you for having me.
All right, we have so much to talk about. So you say if you're traveling for the holidays, you should really be mindful of your health. What are some of the things we can do or keep in mind?
Absolutely. So there are an expected 55 million people traveling this year, of which about 27 million will be via air. So chances are you are going to be likely to catch some of those germs or at least be around someone that's sick. Okay. So it's important to keep that in mind while you travel, but not just during your travel plans. It's also very important to keep in mind of your health a couple weeks before. That's typically a very vulnerable time for our immune systems. We're going to holiday parties, indulging in too much alcohol, skipping out on sleep. And so it's important to be mindful of your health beforehand and not just when you travel as well.
Okay, so what are the things that affects our immune system?
So our immune system is our basic defense system. It helps us recognize and fight off any potentially harmful microorganisms like viruses or bacteria. And just like our body's basic needs, our immune system has extremely basic needs: adequate sleep, hydration, nutrition, exercise, and proper stress management.
That's a lot.
It is, but doable.
Yeah, doable, and our body needs it, so, and you do not want to get sick. So what can we do to prevent getting sick?
First and foremost, talk to your doctor about what vaccines are right for you. Typically, the CDC recommends anyone over the age of 6 months to get their flu shot every year. Other vaccines to keep in mind are your Tdap vaccine, the tetanus, diphtheria, pertussis. Specifically, the P, pertussis, helps newborns. So if you're going to be visiting family with newborns or young children, make sure you're up to date on your Tdap vaccine. And then our seniors over the age of 65 or our little kiddos under the age of 2, any chronic medical illnesses or smokers, we also recommend getting the pneumonia vaccine. So check in with your doctor about that. Keep stress at a minimum. So stress
Which
really
is a little hard to do sometimes,
is.
Especially this time of year, right?
It totally is, but incorporating things like exercise, meditation, yoga, that keeps our cortisol hormone on the lower end, which helps our immune system fight off things a little bit better.
You know, you're talking about all these vaccinations. Is it a whole different ballgame when you're traveling internationally?
It can be. Depending on your destination, I usually recommend our patients check out a travel clinic or see their primary care physician at least 6 to 8 weeks beforehand to get updated on any vaccines that they may need that are recommended or even required depending on destinations, get potential medications they may need specifically for malaria or traveler's diarrhea. That can be super helpful. So checking out the CDC website, www.cdc.gov/travel, is a good way to start to get some of these information about what you may need. Also, if you have prescription medications, take an ample supply and take a written list or an electronic version of all of your medications. That could be helpful.
Yeah, that is great advice. Any medications or supplements you recommend?
So the mainstay of trying to stay healthy, wash your hands. We touch a lot of surfaces, especially if we are traveling. Washing your hands is super helpful. Medications-wise, ibuprofen, acetaminophen can be helpful for any general aches and pains, any fevers, and typically decongestants, antihistamines, and cough medication, depending on your symptoms, can be helpful. A lot of herbs and supplements don't have the science behind it, so there's a lot on the market, but unfortunately there's not great evidence. Zinc lozenges, as well as pelargonium or umca, can sometimes be helpful, and vitamin D has some evidence that can be helpful, but the mainstay: rest, hydration, and treat your symptoms if you have them.
Yeah, that is good. My husband will say if you're starting to feel sick, just eat a lot of oranges. I don't know if that makes a difference.
It's true. It is true. Staying hydrated, so cooler temperatures bring down humidity, which dries out our nasal passages, and that predisposes us to getting sick. So drinking lots of water, eating your fruits and veggies, the best way.
They do it. Okay, well, I'm not going to tell him he's right, but you just confirmed that. Okay, so you mentioned medications, taking those along with you. What else should we take along with us if we're going on a trip?
So I take a very little travel kit with me. This is something that my mom used to do, and I just kind of carried it forward. Basic stuff: hand sanitizer, sunscreen, taking acetaminophen, ibuprofen for any aches and pains or potentially fevers. I also like to take some allergy medication as well, and any decongestants. And I typically am very prone to sprains and whatnot, so I take an ACE bandage with me as well.
Are you saying you're a little clumsy?
A little bit, just a bit.
So am I. I'm with you on that. Well, you are actually traveling, so you're going to put all of this good advice to good use.
I am going to take my own advice.
Yes, all right. That is great. Well, Dr. Marula, thank you so much, and safe travels for you.
Thank you. Happy holidays.
All right. Happy holidays to you, too. And we'll be right back.